Good evening, I'm Devin Bartolotta. We have yet to flatten the curve, according to Governor John Bel Edwards. He says Louisiana has not yet reached its peak in coronavirus cases. This comes as the state struggles with treating patients infected with the virus. Here are the latest numbers. There have been 137 deaths over a 2.5-week period. 3,300 cases have been confirmed from state and private labs. Right now, 927 patients are hospitalized with the illness. More than 300 of those are using ventilators. Edwards says Louisiana needs thousands more in order to treat the growing number of patients. The Louisiana Department of Health has now pinpointed 11 coronavirus clusters, most recently naming St. Joseph of Harahan Living Facility. Right now, we know there's been at least one death there due to the virus and at least one other confirmed case. However, a source inside the home tells Eyewitness News that there are more deaths than are being reported so far, and several staff members are out sick. The health department classifies clusters as 2 or more cases that appear to be connected. You can tune in to Face the Nation tomorrow night. Governor John Bel Edwards will be on the show talking about how Louisiana is dealing with this pandemic. That's right here on Channel 4 at 9:30. Bobby Hebert Sr., the father of former Saints quarterback Bobby Hebert, has passed away. His son confirmed last night on WWL radio that the 81-year-old had recently been diagnosed with coronavirus. Sr. was an LSU graduate who raised his family in Cutoff, Louisiana. He died this morning. Sr.'s grandson, T-Bob Hebert, posted a tribute on Twitter saying, quote, "This is my namesake, Bobby Hebert Sr. He is the wisest, kindest, and most tactful person I have ever known." State and local officials are in the process of turning the convention center into a makeshift hospital for COVID-19 patients. More than 100 hospital beds should be in place by the end of the weekend. Megan Key is live there with more. Megan?
Yeah, the Morial Convention Center will be a place to quarantine and treat COVID-19 patients with milder symptoms, freeing up ICU beds in our hospitals for more serious cases. As it stands right now, we know that there are more than 3,000 cases of COVID-19 in Louisiana, along with 137 deaths reported. Governor John Bel Edwards has repeatedly warned us if we don't flatten the curve soon, our healthcare system could soon be overrun. A temporary solution is transforming the convention center into a larger facility to treat patients. As thousands of New Orleanians sit anxiously at home in quarantine, there's a few things you can do to help.
I'm really asking everyone to think about the elderly neighbors or family members they might have. If you can just order a meal for someone or do a grocery run for someone, that's really going to help them out, and it also takes some of the strain off of these community organizations that are really stretched right now. If you want to get more involved, you can volunteer with Second Harvest Food Bank, doing food distribution or some of the behind-the-scenes work that they need done.
Of course, donations are another great alternative to help out during this time. By the end of the weekend, the first 120 hospital beds should be set up here at the convention center, with more than 1,000 hospital beds coming the next week. Reporting live at the convention center, Megan Key, Eyewitness News.
All right, Megan, thank you. New Orleans leaders need your help to make sure first responders have what they need to fight the pandemic. Today marked the first day of the citywide equipment drive. Here's a list of needed, unused, and unopened supplies. Surgical P100 and N95 masks, gloves, disposable medical gowns, goggles, and face shields. And here's a list of the 3 drop-off locations. Make sure your donations are wrapped up. The drive will last until next Sunday. A healthcare supply shortage impacts communities across the nation right now, but many of you ask, why is there a scramble for supplies? Let's connect the dots. Personal protective equipment, also known as PPEs, are essential to keep all the nurses and doctors treating coronavirus patients safe. They include things like face masks, face shields, gowns, and gloves. Those items are supposed to be disposable, so the virus is not spread between patients or to other healthcare workers. But we have already seen numerous reports of workers having to reuse equipment because of shortages. You may be asking, why doesn't the U.S. have a stockpile of these items? Well, it does. FEMA has a strategic reserve of N95 masks, which offer much more protection than the loose-fitting surgical masks. And it has already started to distribute those to some of the hardest hit states. But for other areas, governors are now having to buy on the open market, often competing with other governors doing the same thing. That is sending prices soaring.